Hey, good afternoon, everyone. We are here at our Facebook Live series to talk about taking the bite out of TMJ. Those of you that don't know what TMJ is, it's that clicking, popping, pain, locking of the jaw. This is a really common ailment that affects a whole lot of people. One of the most common ailments next to back pain and headaches. So a lot of people out there dealing with this, and we are going to talk a lot about what is TMJ, what causes it, and what we can do about it naturally, especially working to avoid surgery, working to avoid a lot more of those invasive type procedures that deal in treating that. So first, those of you that don't know me, I am Dr. Alex Kallio, chiropractor here in Lincoln. I am the clinic director, owner of Comfort Family Chiropractic, and I have been in practice nearly 20 years. So over that time, we have dealt really extensively in TMJ treatment, worked with a lot of orthodontists and dentists over the year as well, and co-managing this condition. So we're going to get you some really good information today. And biggest thing there, those of you that if we get some people joining us today on the live feed, make sure comment below. Make sure to let me know you're here. Tag, hit that wow face, hit the heart, and tag a friend. If you know someone that is dealing with TMJ symptoms, make sure to tag them in the video. Make sure they're seeing this video. This is a lot of good information they're really going to want to see, and certainly share it with friends and family. So again, let me know you're here. Let Facebook know you're here. Hit that wow button and tag a friend in the video. So we're going to kind of jump in, and especially when it comes to talking the jaw, one of the first things we need to kind of understand is a little bit of the anatomy there and how that jaw works. So bear with me here. We're going to try to get this up here for everyone to see. This is a picture of the jaw from the side. We can see here the teeth as we come down the jaw, coming up into more where it connects right in front of the ear here in what's called the condyle, that bone here. And what we can see attaching in, we have a muscle, kind of two muscles here, called the pterygoid, the lateral pterygoid muscle. And we have an inferior head and the superior head that attaches up through here. The superior head of this muscle is the one we're really interested in, because as this comes in, you can see it attaches into this structure just above that condyle. And that is a tendon comes in and becomes what's called an articular disc. And just above the condyle is where this disc sits in there. And normally that disc slides with the jaw. So as we look at opening the mouth and we do that motion, that disc slides with it and should stay with that to keep that moving nice and smooth. And what happens many times, and those of you that have TMJ symptoms, we may get into a lot of clenching or tension in the jaw. We get grinding, clenching. Your dentist maybe has worked with you on this. And many times it is that clenching and grinding motion that causes imbalances in those pterygoid muscles. And so as one side gets tighter than the other, we end up with a deviation in the jaw. Some of you may have noticed or felt when you open or look in the mirror, you can feel your jaw shift to one side or the other. That is a sign we've got extra pull from those pterygoid muscles, specifically that lateral pterygoid muscle. So when that is really tight up in there, that is creating a lot of that issue. And the kind of typical treatment from your dentist might be a bite splint. They'll give a night guard, get that molded in, and give that to you at night to help open that out and kind of keep that pressure in, also to try to help reduce you from clenching or biting down so much. But many times it doesn't address that muscular imbalance. And so we've got to be able to do that as well. And really what we get into seeing here then is kind of a combination therapy. And many times, again, we mentioned working with orthodontists and dentists, and usually it does take a team a little bit to get this settled down, but we have to get those muscles balanced through. And bear with me one second. We're going to try to give you guys a better view of how this actually works. And I'm going to show you a quick little video here. If we can get this going. So I'm going to bring this up. Let's see if we can get everybody to see this. And kind of a motion view of what happens here. So here we can see the jaw. And we'll start this here. As we come in, here we see that articular disc and where the condyle sits. And as we open, it should slide with the jaw. We can see that kind of moving through. What will happen though is that disc will get trapped in front and then pop back. And so we'll get this snap back as that superior head of that lateral pterygoid pulls that disc forward, it catches it. And so that is what's actually causing the popping sound when you hear your jaw pop or click. It is that articular disc getting caught in front and then popping back as we open and close. So we have to start loosening those pterygoid muscles to allow that to reset and stop pulling that articular disc forward. The surgical intervention for that, they'll actually go in many times when people have a lot of pain or locking, popping in there, they'll actually take and reset that disc in there through surgery, or many times, sometimes even remove it. But what you get into many times is, again, if those are imbalanced tissues, it's gonna come back over time. So we've got to start to work that. And so one of the ways we do that is actually through some massage technique. Now, I'm not gonna lie, we get in there and work those pterygoids. For somebody who's really tightened up, it can be a little uncomfortable. You think of getting a deep tissue massage or getting that worked out, that can be very uncomfortable. It will actually work in the muscle, kind of up, sits way back up in here on the underside of the inside the jaw, just on the inside of the teeth, and do some trigger point massage work on those muscles. So most people, after getting that, are amazed at how much looser the jaw will feel, how much better motion they will have. We really get those muscles worked out good. Makes a huge differential to start with. And then from the chiropractic end, we will actually manipulate or work with the actual joint. So again, it doesn't hurt. That part's not painful at all, but we're working to create better motion, better mobility within that joint, just like we would a spinal joint in the back or neck. So we'll do some of the muscle work on those pterygoids inside. We'll do some manipulation with the joint, and then typically we'll get into some exercises to start to balance those pterygoid muscles. We've got to get both the right and left pterygoids firing at the same time, so as we open and close, it will track midline versus pulling to one side or the other. So that's done through both some exercises, done through some direct trigger point work on the inside of those muscles, done through some manipulation of the jaw, and then many times, especially in severe cases, if the actual bite is off, then we'll work with the dentist to help get a bite splint or a night guard in to help hold that so that the work we are doing kind of is maintained and we don't lose that just through the course of the night or day because somebody's biting down so much. We also have to take a look at sleep postures and pillow that we're on. If we do all this work and you go home and are sleeping, on your stomach or on your face and we're pushing that jaw off too, that also will cause some of these issues. So, there's lots of things that can trigger that when we get into seeing kind of the reasons behind it. So those of you that are jumping on, again, if anybody that's on with us has TMJ issues, just comment yes or no there below. Let us know that you're here, and we'll have a little time for some questions if anybody's on with us by the end. So, when we look at this though, if any of you have had TMJ work done, again, it can be a little uncomfortable, but boy, the results post are amazing when we get someone who's been mistracking so bad, has had trouble opening, chewing, biting. We can even get headaches. It can be a very common occurrence with TMJ issues just because of the nerve structure and how so much of this sits up again into the upper neck and head. So many times those with TMJ, we're also checking a lot of through the neck, through the jaw, through a lot of those muscles kind of concurrently at the same time. We want to make sure we're getting the whole problem. And we have to look at posture too. Much as last week when we talked about headaches, a lot of that head forward, head down posture positioning all plays in with tension, which especially when we talk jaw tension, can be a big player within that too. Types of foods that we're eating, we also have to watch. Somebody with clicking or popping in the jaw, we don't want to be eating, taffy, probably, even looking at things, especially in Nebraska, looking at steaks. Real heavy, tough, chewy foods are going to increase that popping, clicking imbalance in there too. So at least for a time, we've got to restrict some types of foods and look at changing a little bit of our eating habits along with the exercises, along with the posture training, along with doing some of the direct work within that joint as well. So we've got to look at a lot of different avenues. And then certainly, again, from the dental side, do we have a reason that has gotten off? Sometimes we can have a tooth maybe that has shifted or moved or is riding high. Bite can be off, that kind of thing. So many times we will make this a dual chiropractic and PT that we're doing along with the dental visits to make sure that we're getting this from all all angles. And again, sleep posture, some of those type of things. So as we look at it, kind of a whole, TMJ can be a really complicated type of condition, but also at the same time responds really well that many times we can avoid getting into the surgical fixes or certainly the more invasive type fixes as long as we're getting to it early, which many times means, if we have clicking or popping, we don't want to just ignore it and think that's kind of it doesn't hurt, so it's not that big a deal kind of thing. Over time, that will eventually lead to issues. And the biggest thing that happens, going back to our visual here, when we look at that disc and how that sits, again, where that articular disc sits, it is the tissue behind that disc that creates a lot of the pain. The disc itself is not innervated, and so that does not cause the pain. It's many times why we can get that pop or click and not have pain. But all of the tissue that attaches behind that disc is called the retrodiscal tissue, and that is highly innervated. So if that tissue starts to get pulled forward, if that pterygoid is pulling hard enough and that tissue gets pulled into the joint space, that is when that becomes extremely painful. And many times that's where the surgical cases will come in. But if we can get to those, get that calmed out, we're going to be able to head that off, certainly prevent the locking and the pain associated with it, and hopefully head off a surgery there as well. That's not a real fun recovery when we start talking jaw surgery. So sooner we can get to those things, the better. The sooner it's going to help to calm that down, and definitely, obviously, the sooner we get to it, the less time and thing that's going to cost it to help calm this. So, a couple things we want to start looking at for those of you, at home and those maybe joining us now. Again, let us know you're here. Hit that wow button, hit the like button, share this to a friend, tag somebody in it that is dealing with TMJ issues or, popping, clicking there in the jaw. Make sure they're getting this information out there. But we've got to kind of look at, on all fronts, to recap again, we need to make sure we're evaluating the motion, alignment within the jaw. We need to check all that soft tissue, especially up inside those pterygoid muscles. We're going to look at posture. We're going to look at sleep positioning. We're going to look at from your dental side, your alignment and bite within the jaw, see if that needs to be addressed. We're going to get some exercises and do quite a bit of work across the board on that. So, anybody's has any questions, you can certainly write below. Type those in. I'll be happy to answer any questions. Certainly, if you're catching this in a rebroadcast, still comment. You can comment down below. We'll still see those and certainly can help you get information. If you're in our area, we'd sure love to help you out. Those of you that are seeing this video and are in the Lincoln area, certainly we don't want you sitting at home just dealing with this or not doing anything for it. So kind of maybe stir you a little bit. We certainly would like to offer you a free consultation. We'd love to sit down, chat about your condition. We'll do that at no charge and see if it's something we think chiropractic could help. If it is, great. We'll do get into a more thorough exam, possibly some x-rays depending on what we're finding in that exam, and then can move forward from there. But certainly we'd love to offer you a free consultation to find out if this is something we can help with. If it's not, we'll get you to the right place. If it is, great. We'll talk some options and hopefully get you heading in a great direction. But you can reach us easily at 402-484-5166 or stop on in and see us. We're at 1600 South 70th Street here in Lincoln, and you can stop in, see us anytime. Otherwise, share this video, tag someone in it that needs to see this information, and we'll be back next week, 1 o'clock again. I think we're going to be talking about kids and sports and certainly common sports injuries that we're seeing with children, and how chiropractic care can help that. So you guys have a great day. We'll catch you next time.